raising another whole series of issues, and the complexity deepens. I haven't even begun to get through my list of questions, but I want to hear your voice. So I'm going to hand it over to Chung for a minute to respond to the same issues, and I'm going to go outside and get ready to bring some other questions back to you.
Yeah, I think we want to serve people to have better development, and hopefully, because a lot of poverty issue is related to sickness, to illness, and then it is our common goal that if we make the people healthier, they can be more productive. But and so that they can have better development and they can afford healthcare, and then it would be a cycle upward. But the problem is now in some areas they have received better healthcare and they have become more productive, but there's nothing to do. So even if they're more productive, there's nothing for development. So my point about integration is that the integration should be also outside. For example, in our group, we have launched a number of social enterprises so that we bring jobs to these villages. A lot of the people with HIV, although they now have treatment, they have better, so they are more productive, they are not bedridden, but at the same time there's nothing to do in the villages. And the town center is 20 kilometers away. So but at the same time, in the past, they could work for a more labor-intensive job, like working in the field, but now with HIV, they cannot. But there's nothing much else to do. So we bring jobs to them, such as an environmental manufacturing workshop, so that they could do something and generate an income. And with the income, they can afford other things, including sustainable healthcare. So to us, the solution is not just healthcare, but also when they receive better healthcare, when they have better, when they live better, and then we should use the productivity to make them generate more income so that the cycle will be cycling upwards.
I love listening to all three of you, because what I'm hearing is the voices of entrepreneurs, the voices of people who see innovation as a real potential. And I think of all the areas, healthcare probably more than others, has the greatest opportunity for entrepreneurs and innovation. It's sort of ripe for that. But let me stop talking, and we've got a line of people. For some reason, this side is very active. This side over there, I don't know what happened, went to sleep or something. Let's start here.
For lifelong health starts in the first 1,000 days, which starts during pregnancy. So even if we do education, nutrition, and health, if we go past 2 years old and they become stunted and undernourished, any kind of intervention would just keep them like poorly stunted. They lose their productivity because we miss them those first 1,000 days. And sometimes, most of us, our empathy goes to people with HIV, with AIDS. It's not that it's not important, all right? Like atherosclerosis and heart disease, because these are things that we feel. But how about pregnant women? How about babies who cannot fight for their lives and like ask for better health care for themselves? So I'm talking about breastfeeding. Breastfeeding is like the topmost best intervention to prevent deaths and illnesses to all children all over the world, and it comes at no cost at all. Healthcare usually comes with like commodity-driven like medicines, vitamins, supplements, but this basic commodity, this basic right for children to be fed right, is sometimes being missed because of like selfish industries, because industries earn from the misconceptions on healthcare. So my question would be, since investing in these, like what you said, that community-based workers are like cost-effective, breastfeeding is like when you invest $1, you get back $12, and that's like a fact. But then it has the least investment in all healthcare policies all around the world. And I'm just like, how can the focus be shifted to those issues? especially if those people who are in it are not part of policy making?
A good question, thank you. So again, sometimes it's a paradox, isn't it? How the simplest and most cost-effective are the ones that are most difficult to
Yes.
do that. So in order of time, because we're really going to be running out of time before now, if you could keep your questions shorter, and then we can, why don't we take 2 or 3 of these and then we can respond to these, okay?
I would like just to ask, what stops industries from supporting those kinds of interventions when it's so cost effective?
Okay.
So what would your advice be to these kind of innovators who have these kinds of ideas? So
Okay.
where do we go? What do we do?
All right, let's have the person right behind you. And I'll get over to the other side.
Hi, my name is Gia. So just to give you context, I'm with a health tech startup here in the Philippines. So we're trying to solve the problem of non-communicable diseases. Particularly, Mr. Chung mentioned about the problem of adherence and also access. And I think these are correlated and have dependence with each other. So we're trying to solve it through innovation. But one of the things we're encountering in this ecosystem, the healthcare startup ecosystem, is that even though a lot of innovations are available, some are really still in brick and mortar means or traditional methods. And when it comes to technology innovations, it's hard to convince some of the traditional doctors to adapt the technology. It's really a problem of bringing the ecosystem together and helping everyone accept that innovation is something that can benefit us. So how do you think we can address this problem of bringing the ecosystem together, not just the government, but also the medical communities and the doctors?
Yeah, again, we kept coming up against the ecosystem, right, and how this is all interrelated in that. All right, let me take another one here in the middle.
Unemployment barriers for people with medical, psychosocial, and physical disabilities, and we are talking about health and workplace. And I'm wondering what is your approach to influence key decision makers in companies and HR professionals to make sure that people with medical conditions are also included and are not discriminated in the workplace?
Very good. Question. Okay, let's have a couple of questions over here. It's not working yet.
Good afternoon. I'm Sofia Montana from Where There Is Hope organization. We're a mental health outreach program, and we provide, we guide and inspire through scripture, testimony, and art. So we want to provide a community for Filipinos who are suffering with mental illnesses. But the thing is, in our country, especially if you go to the Philippine General Hospital, it takes you 6 months to get an appointment. And it might take you another 6 months to have a follow-up appointment. And sometimes you won't see the same doctor. So in the Philippines, there's only 5 specialists for 100 million people. And I know a lot of us are either part of social entrepreneurs or we're businessmen, but even if we're not in the government, what can we do to alleviate this situation, and how can the future be different from now?
Okay, again, a good issue. So there's a lot of questions. You want to respond to some of these, because otherwise we could have...
I think there's one voice we are all hearing, that healthcare needs to be a lot more inclusive of all elements, because everyone, when we are cut, we all bleed red. So whatever disease, whatever we are having, it needs to be, there are issues happening at each level. From primary healthcare, mother and child, to HIV AIDS. Everyone needs more care. Now, I think hybrid systems work also, what we are doing. There is a system for ultra poor, and that means that in that area, for example, in mother and child, let's address that. We have 80% of women and children. From 4 checkups of ANC, PNC, we've got birth attendants whom we train in the communities. They are doing referrals. Over the last 6 years, we have not had one mother and child death. This is unprecedented in Bangladesh actually. And we have had that because we take care. And this is also right from awareness to actually giving the care. But we have to make some decisions that some things we cannot do, and those are very hard decisions. But 80 to 85% are all primary healthcare issues, mother and child issues, nutritional issues, worms. People are dying of worms. Children are dying of worms. Unprecedented, but primary healthcare issues. So we address primary healthcare very strongly up to secondary health, but tertiary health we cannot do. So what we cannot do, we have to also communicate on what can be done and what we cannot do. And what we cannot do, we address it and refer it to other centers like the government centers. But at least the 80 to 85% of primary healthcare we deal with very strongly, and also about 7-8% of secondary healthcare we deal with. So it's a kind of a hybrid system of also some amount of payments are given in certain areas, whereas in the ultra-poor areas we don't take payments. So in that case the gaps also come in. And it's the same with HIV, you will answer of course better, but we can treat up to STDs, but we cannot do HIV. So what we can't do, we have to step back and say we cannot do that. But you will be able to say.
Okay, any other brief comments up there you want to add to that?
I actually want to about the workplace. In China, there's a trend that the physical checkup for pre-employment is getting stricter and stricter, sometimes unnecessary, and including HIV. And sometimes a lot of people, HIV now is less of a medical issue. A lot of people could lead a very healthy life, but it is still a social issue because of the social stigma, including job discrimination. And sometimes the discrimination started even before you got a job. And I think that's something we're very concerned as well.
Yeah. Two important issues here, the social dimensions of healthcare and the stigma associated with a lot of issues, including HIV, addictions, etc.
Brad, can I just say something, just to piggyback on what Runa said? Just listening to the questions, I think in my, no one will object to women's health and maternal health. Absolutely important. I mentioned 60 infant mortalities per day here in the Philippines, right? No one will, I cannot disagree with mental health. In fact, it's an advocacy that we also strongly support. And I guess what Runa's saying, there's this, when you look at the sector, there's so many problems all around, right? Different therapeutic areas, different classes of conditions. I guess my counsel is for each and every one of us is, to try to pick what we can do versus what we can't do. And then what you can do, or what you're willing to do something about, you try to dig deep and try to innovate and come up with new novel solutions, whether it's technology, whether it's online, offline solutions, as someone mentioned earlier, but something novel and innovative that can really address the need. In our case, we chose primary care, we chose affordable medicine, and those are two advocacies that we are pushing. And sometimes people think we're crazy. I mean, people thought our primary care idea, we still get people saying you're crazy, it's not going to work. People say, in communities here in the Philippines, communities pay their family doctors with livestock. So how can you survive? But no, you have to stick to your advocacies. And so if it's affordable medicine, it's pushing that advocacy on affordable medicine. It's educating consumers, physicians, pharmacists, that the generic equivalent is just as strong as branded medicine, and sometimes 30 times cheaper, or 80% more affordable. It's that kind of education that needs to happen, and sometimes you just have to really hammer away, and believe in those advocacies. But no one's going to say that you shouldn't do. No one should tell you that you shouldn't do maternal health or you shouldn't do mental health. If it's a passion, if it's an advocacy, run with it, and just choose to do it.
Thank you, Paolo. Again, we're running out of time as usual, but I want to get comments in, so keep them brief, but at least let's try and get them in. May not have answers.
Good afternoon, I'm Danielle Nakpil. I'm with Sophia. I belong to Where There's Hope org. And I myself I was diagnosed with bipolar disorder type 1 when I was 18. And I go to my psychiatrist every month, and it's so expensive. Medicine is so expensive, and I get hospitalized every now and then. And it's not inclusive in PhilHealth here in the Philippines. So what can you say about inclusion of mental health in legislation or in policy making? How important is it?
Thank you for that question. That's an important one. Let me get one other in if we can. I'm very patient back there.
So good afternoon, I'm Claire David, and I'm very passionate about ethical marketing and health. That's why I read the industry updates. So early this morning, I saw that China is going to lower tariffs on cancer treatment drugs. And then I also had some articles on executives of big pharmaceuticals getting fat bonuses. Then there are issues on like in the promotion actually of drugs. I just love the way Paolo put in business model and how you have mentioned social responsibility within the context of enterprise. How can we articulate this very clearly for the healthcare industry?
We haven't jumped into that issue, which is a very big and contentious issue of big pharma, the most profitable industry sector that there is. And again, the trade-off between coming up with miracle drugs that oftentimes are just not affordable. So how do we balance that off? So let me end. There is, okay, I am very patient. You're going to get the last comment.
Hi, I'm Ayala. I work with AIM, but more to the point, I'm an actuary, and I worked in the health policy sector for over 2 decades. I started when I was 11. Okay, so both locally and internationally. I picked up on many things, the most important being, it's so hard to ask the question, can healthcare be good and inclusive? Because as Runa said, well, what is good and what is inclusive? What we always say in health policies, no country, no matter how rich, can pay for everything for everyone. And that's why I think Paolo and you both said, how can it be sustainable and how can it be affordable? Because if we had endless amounts of money, we can't pay for everything for everyone, but that is never going to happen. You also said that it's an ecosystem, and absolutely it is an ecosystem. There are social issues, educational issues. I don't want to go to male doctors for my OB-GYN. We have issues like that. So I think this issue of everyone has an advocacy, and you just do what you can, is good, but it's not enough. It's not enough. This is one of the most horrible of the wicked problems facing the world. And if we're ever going to solve it, we all have to work together. So I have a group of people that I work with, and one of the things that we're starting to think about is collaborative governance. Essentially, if we think about healthcare, this is the question we ask. How do we prioritize? It is always about prioritizing. Which gaps are most important? Who pays for what? Who does what? So here's my question. What do you think the role is of the private sector in helping government achieve what is possible in terms of truly affordable, quality, acceptable, universal health care? Thank you.
Thank you very much. Well, very frustrating.